slides and whatnot. Thank you. Well, good morning, everyone. We're really excited to have you with us this morning for our first regional school nurse update for the 24-25 school year. So welcome, everyone. It's great to see you. And we're glad you could join us this morning. I am going to pull up some slides. Same things that we had in the past here. Excuse me. So I'm sorry. Let me go back and fix this. I apologize about that. Um, hang on. So for our meeting today, we get to hear from Kathy. And as soon as I can adjust my things here, I will pull up the agenda. So apologies about that. We get to hear from Kathy for our regional school nurse updates. And then we have a regional health update from Dr. Wallace with the Okanagan, Chelan, Douglas Health Districts. And then we'll have Dr. Carter will be joining us. She's an audiologist with Better Hearing of Washington. And she has routinely talked to us about hearing screenings, but I've also asked her to go over some points or review of how to assess ears and eardrums and not just hearing today, so ear health in general. So hopefully we'll be able to have some good takeaways from that as we go into the screening season. So our meeting objective today is not to just get information and resources and opportunities, but to be able to take those into our practice and make sure that we can plan and utilize them in safeguarding student health. And then we also have some meeting goals, and these are really for you to be able to have something to make sure you take away from the meeting. And it's also for the folks that are watching this on YouTube after the fact, so that they can go through the meeting and then be able to fill out the survey at the end to identify 2 resources or practices that they can use in their practice to support what they're doing for their students. And then as always, we have the framework at the bottom because that's the foundation of what we do as school nurses. And it's the foundation for these meetings to be able to provide you information that is going to be relevant to your practice. And today I'm sure we're going to be focusing a lot on perhaps coordination of care or quality improvement. But this is just to remind you of the bedrock of what we do. And so some reminders for the meeting today. This meeting is recorded, and we want to be able to remember to keep your microphones muted, but that does not mean we don't want you to participate. So please, if you have any questions or comments, make sure that you raise your hand or put your question or comment in the chat. Sheila and I and Kathy monitor that so that we can make sure that your comments get expressed to the group. But also, again, these meetings are for you. And so we really want you to be able to be comfortable and participate. And then again, we are offering clock hours for our meetings for the school year. And the information for the PD enroller was in the reminder emails, but I'll also have that again at the end of the meeting. So for receiving clock hours, if you choose to pursue that, you are required to attend the meetings. And if you can't make the live meetings, then we can do, you can watch the recording. There is a survey to fill out for each recording that you watch, but through PD Enroller, it sends out one survey, and then pay for the clock hours, and you'll receive those through PD Enroller. And I have those starred because there's more information that goes into that, but we can talk about that a little bit later. All right, so without further ado, I am going to turn the time over to Kathy for our regional school nurse update. Oh, I'm sorry, you're muted, Kathy.
Yes, I see. Thank you so much for letting me know. But before I start sharing my screen, I just wanted to say welcome back to everyone and how nice it is. I really appreciate it when you guys have a camera to turn on, because I just love to see you. And I just want you to know how much you're appreciated. And so we're going to go through some updates from the state and the region. And I want you to make sure to feel free to ask questions. As Lena said, please use the chat and or ask questions, and we'll be happy to answer anything that you have a question about. So without any more intro, I'm going to go ahead and start sharing my screen. Okay, and how is that looking?
It looks good. We can see it.
Okay, thank you very much. All right, so welcome back everyone to the 24-25 school year, and or welcome to your new positions. We do have some new school nurses and some school nurse case managers joining us today, and we'll be talking about that program as well. But I'm just going to go ahead and go through some updates this morning with you, and let's go ahead and get started. So just very quickly, a quick overview about the School Nurse Corps program and what that is. We are a state-funded program. Each year we are included in the general budget for the legislature. And so we have an apportionment, and it goes directly out to educational service districts through the larger Association of Educational Service Districts, and with assistance from OSPI. So that is the way that our program is funded. We are generally funded to provide financial assistance to a school that is designated as a Class 2 district. Those are largely more rural schools, smaller populations, and needier, although they are certainly not the only school districts with needs, and we recognize that. School Nurse Corps offers support to any school nurse who asks us. If you're a nurse and you're involved in the schools, then we're here to provide you with some levels of support as we are able. Our mission is really to promote health and safety for school students, and certainly we address equity issues as well to make sure that students really have the best access they can have to a school nurse. And our vision is that all children receive equitable full access to school nursing services in order to be healthy, safe, and successful in school and life. This gives you an overview of our area. We are North Central ESD 171, and we serve Chelan, Douglas, Okanagan, and the majority of Grant County. And you can see there are 9 ESDs across the state, and there is a School Nurse Corps administrator at each of these, and an office at each of these 9 ESDs. So a little bit about our service area. We are 4 counties. We cover 12,600 square miles. We have 5 Class 1 school districts. Those are a school district that has over 2,000 students enrolled. We also have Class 2 school districts, so those are less than 2,000. We have 24 of those school districts in our region. We have 1 tribal school and 1 charter school, and we have a number of parochial schools as well. And we are very large geographically. We cover 20% of the state of Washington. So we are large geographically, but in regards to school enrollment for the state, we make up about 4% of the enrollment. So you can see we cover a wide area. Our farthest southern district is Warden, and then our farthest north district is Oroville. So a wide expanse of area. There are 3 of us in the office, so I serve as the director. You've met Lena. Lena's our school nurse team leader, and you've also met Sheila. Sheila's our ProServe administrative assistant. And all 3 of us are here to provide you with whatever level of support is available to us. So going through some North Central ESD updates. First of all, I want to welcome new school nurses. We have 7 new school nurses in the region. We also have new migrant nurse case managers in the region. So we have 4 new migrant nurse case managers, and that is a program that we see expanding in our area. We have had in the past a few migrant nurse case manager positions in a few of our districts, but now we are expanding out to provide an additional level of support to school nurses through this migrant nurse case manager position. So for those of you who are going to be working with Blanca, Adriana, Daisy, and Ruby, you can see that they have assignments. In some case, they're with one district. In some case, they're with multiple districts, and they are just getting oriented to their positions and getting started now. All right, and so who are you joining? All of those that are new to school nursing, you are joining a wonderful school nurse team. This is a snapshot of some of our school nurses from our region, and this was taken at our last school nurse workshop in May of last year. So something that we're going to be doing again this year when we get into May. So some quick updates on resources. We just want to make sure that everybody knows how to get to North Central ESD resources. So just starting out with our web pages, if you go to the North Central ESD main web page, you can go to the Student Support Services area. And within Student Support Services, you'll find Student Safety and Well-Being, and there is a link here to School Nurse Corps. And on the School Nurse Corps page, when we talk about things like a school nurse directory, a school nurse calendar, school nurse professional development opportunities, your electronic resources like your online guides and other resources that are posted here, orientation information, mentoring, competency, and evaluation. Those things are all posted on the School Nurse Corps webpage, and you can access them from these tabs on the left-hand side of the page. So that is the main School Nurse Corps website, web pages on the North Central ESD webpage, but they are not the only one. So additionally, we have a public health resources webpage. So this page, if you're again, log into the main page, North Central ESD, and look under resources, you will find a drop down and see public health resources listed. So on the public health resources page, you're going to find your contacts, which are Lena and Eric Johnston. So here are your contacts. Here are your quick links to regional public health districts. Here are quick links to other tools through Washington Department of Health, the school's website, the K-12 Health Notebook. If you're not familiar with those, we encourage you to check them out. If you continue scrolling down this web page, you'll see a link to your data dashboards. And your data dashboards are something we want to make sure that you're familiar with and that you use. One of the things you might consider opening if you're not familiar with your dashboards is to just take a look at your immunization dashboard. You can look at your immunization status. It's posted from last year by school district. So you should be able to find information that applies directly to you or your region by looking at the data dashboard. If you were to scroll down the page, you'll find below here topic specific resources. And so in that area, you're going to be able to drill down even further into very specific public health related resources. So we wanted to make sure you were aware of this. This page was created in response to new legislation that required all ESDs and school districts to provide public health updates directly on their web pages. So you should be able to see, even on your own website at your school district, it may not have been launched yet, but there will be access to public health resources. It may be just a direct link to the North Central ESD page, or it may be a link to another page, but you should see those things start to appear on your own district websites. Okay, the other things I wanted to make sure you were aware of are your resources that are available to you on your Google. When we talk about Google and we talk about your Google folders, what the main folder that we're really referring to is the folder that's called All Access to All School Nurses. So one of the things we want to make sure is when you have access to it, we can see exactly who's been given access by clicking the little link here. And in our view, we can see who has access. So if you tell us you can't get into it, we would look to see why and make sure that you have that access and you're able to see it. Because rather than keep all of these materials out on a website, we keep them all on our Google folders. So a couple of things I wanted to show you on these. One is that you have control over what your view of this page looks like. And so you'll see this little icon up here. And so if you look at this page and you say, gosh, my page does not look like this, then you could probably change your view and you could have it appear differently to you. This is like a little icon button view where you can see everything is organized by title. And there are multiple folders in here. The two that I want to make sure you're aware of, just as reminders, is that your practice manuals are in one of these folders and that your toolkits are in one of these folders. So when you look at practice manuals, so now I've drilled down into this folder called practice manuals, and this is how my practice manuals appear. I have them appearing as these little images. You can change your view. If you don't like this view, you could change it. So you could just look at a list of titles. That'd be another way to look at this. But you can see a snapshot here of multiple manuals. So if you need a DOH manual or an OSPI manual or some other manual that is directing your practice for school nursing, excuse me, you should find it in this folder. If you're missing something, you don't find it, let us know and we'll find it for you and we'll make sure that it gets loaded in here. The next one is I wanted to make sure you were aware of was the toolkits. So again, you can change your view. If you don't like this view, you can change it, but your toolkits you can see are more based on more like a diagnosis where we have grouped like materials together. So instead of just looking at a practice manual, you might be looking at a practice manual and forms and other resources that all are applying to this particular title. So if I clicked on asthma, for example, I'd not only find the AIMS manual, but I would also find a number of other materials related to asthma. The reason we put these all under toolkits are you can see the list grows and grows as we bring in materials for different types of diagnoses, trying to make them easier for you to find. And when we do that, it just creates lengthier and lengthier lists. So we broke these off into what we call toolkits, where like materials are organized together and you don't have to go out and search for them in a different way. Okay, any questions on ESD services or updates? Okay, then we're going to move into the NASN updates. So as Lena pointed out in her objectives for this meeting, we just want to make sure that everyone is aware that NASN has revised their framework for school nursing practice. And so you can see now that we have reduced our number of categories and kind of combined things to make it easier and to make it more meaningful really for school nurses, both in the image of the model as well as the definitions of what kind of activities, for example, are illustrating school nurse practice. So it's now broken only into 4 categories of care coordination, quality improvement, leadership, and community and public health. And rather than just a few bullets, we've got a little bit lengthier description here of what kind of activities really fit into these different categories. So this is just a reminder. We covered this last year, and I want to make sure that everyone has a copy of this. And these are all available for download for you from the NASN website to keep handy. One of the things we really encourage people to do is to use these kind of tools during their performance evaluations. I'm moving on to the framework grid or table. And really what this does is it helps take those different activities and match them up with your standards of practice, and then your 4 categories of care coordination, leadership, quality improvement, and community and public health. This is about a 4-page document, and it's available again on the NASN website for you. This would be a great tool if you wanted to incorporate a tool like this into your performance evaluation, because oftentimes school nurses are being evaluated by a non-clinical person at their schools. That could be your superintendent, it could be a director of a program, and they often don't have a lot of knowledge about school nursing and what school nurses are actually doing. And using tools like this to highlight what you're doing and to then explain how you did it and what actually was you created or developed as you worked through these different categories. You know, how many students were assessed? How many chronic conditions are you providing care for? These types of tools could be really helpful for them to understand the complexity of school nursing practice. So you can download all of these. You can download the framework chart. You can download the poster. And then there is a nice article about the revisions that was done in May of 2024. And that's available for you all at these links. Additional NASN resources, we just wanted to make sure that as reminders that people are familiar with these. The NASN School Nurse Journal, this is mailed, excuse me, this is mailed to all members of NASN. Excuse me. So those of you who are new members, it might take a while for you to get your first journal mailed to you. But if you are in School Nurse Corps, you are automatically a member of NASN and a member of the School Nurse Organization of Washington, and that is SNO, and we take care of your fee to your membership fee. If you are with a Class 1 district, we really encourage you to discuss with your superintendent or your supervisor how you might become a member of these organizations. And once you are a member, your journal is mailed directly to you. There are also podcasts that are available. So this is another way that people like to get updates from NASN or hear updated information about either, different care or different practices. And podcasts are relatively short, so they don't take a lot of time. And so you can link to those directly from this page. NASN professional practice documents. This is the one page you can go to where you can find things like your practice standards, documents that have been put out by NASN on school nursing practice. They are all organized on one web page, so you can find those posted there. And then NASN grant and scholarship opportunities. I just wanted to bring this to your attention because the deadline is approaching. It's October 15th, and there are a number of different NASN grants and scholarship opportunities available. And so if you are going back to school, if you are going to a conference, then we encourage you to take a look at the different scholarship funds that are available through NASN. Okay, now we're going to get into some Washington Department of Health updates. Any questions about NASN? And if anyone's writing questions in the chat, Sheila and Lena, if you could let me know, because I'm not able to see the chat. Okay, we're going to move into Washington DOH updates. So just as, again, I want to make sure that everyone is aware of the schools specific Washington Department of Health webpage. So I would encourage you to bookmark this page and keep it handy because many of the new materials as they come out, you're going to find the links posted directly on this main webpage. You can see what's happening now and you can see key resources. And these are things that are just recently updated by Washington State Department of Health. So quick links on this page. You can get to just about everything you need related to schools from this main web page. So this is just some examples. If I were to scroll down the page, once I have the main page open, I can start scrolling and I can look into some of these major categories where I can find a lot of resources very specific to those types of things. This is where I could also subscribe to email updates on school and environmental health and safety information and get emails directly from the Department of Health when things are revised, so you never miss anything. And then program contact information. So lots of information all on that main page. And then it drills down even further into specific health conditions, injury and violence, promoting healthy decision making. So even further down into more specific things, more specific topics and resources that are available through the Department of Health or other agencies that Department of Health partners with to provide evidence-based practice for you. Okay, so some updates. We're going to kind of go through these in categories. So we're going to start out with immunization updates. So just wanting to let you know, Washington State, along with many other states, sometimes has issues with compliance for immunization. And Washington Department of Health is going to be launching in January of 2025. They're going to launch a project to try to collect information about very good practices in the schools that have very high rates of compliance with their immunizations, and then looking at also what barriers do districts have when there are districts who have very high out of compliance rates with immunizations. What are their barriers that they are finding so that the Department of Health can begin looking at how could they put together some strategies that would really help promote immunizations for students and immunization compliance. Also, some of our local health jurisdictions, I know Okanagan County and Chelan Douglas Health District and probably Grant County as well have received a little bit of funding to help support them in their efforts. And so those three county health districts will also be doing some smaller projects around immunizations and looking at more county specific, how could we help support immunizations in our region. So those are just some things that are coming up to be watching for, and we'll have more information as those roll out. All school nurses should be using the 24-25 school requirements at this point. So this is just an example of the tool that's available from the Washington State Department of Health as a quick cheat sheet for you on the immunizations and when they are due. Tracking and immunization. So immunization due dates, I just want to remind people that immunization due date for this year is going to be December 1st of 2024. Now, many of you I know are using School Module, and so School Module is an electronic format for collecting data that is all tied into the Washington State immunization tracking program. Unfortunately, we still have a few districts who have not transitioned over to School Module yet. And so for those districts who have not transitioned over, your due date for your data is going to be December 1st. And so we'll be working with you and the Department of Health to make sure that you understand how to collect and report your data, because you'll be collecting it in a different way than the folks who have already moved to the School Module product for immunization tracking. For a couple of new guides that are out, well, certainly the immunization manual for schools that had some very, very minor revisions. And so there is a new manual. It's dated 2024, and you can link to it here. So we want to make sure you're using the current guide as your reference. And then Stephanie Snitley shared this with me. It's called Understanding and Interpreting Immunization Records from Outside the United States. It was developed by King County Health District. It's really a nice tool. We have had a tool previously. If you look in the immunization folder in our Google Drive, you'll find another version of this type of interpretation document that was created by the Department of Health, a little bit different than this one. This is a multi-page document that's it's very nicely organized, and I'd encourage you to take a look at it and add it to your own toolkit as you have kids coming in from out of country and you're trying to interpret their immunization status. Okay, we are getting a few questions about COVID updates, and so or COVID practice and how and what schools should be doing at this time around COVID. So as of April of last year, the Department of Health pretty much adopted the CDC guidelines for how COVID was going to be managed. And so the current school guidelines really reflect the community guidelines for COVID. So you can find them on the website called What to Do When You Are Sick with COVID-19 or Another Respiratory Virus. And that there's a link on the page to that. And again, there's also a link to the CDC guidelines. And what they've done is essentially, I know in our old previous guidance, there was really very strict guidance on, students were going to be required to be out of school for exactly 5 days or exactly 10 days or whatever, wherever they were at in terms of their illness. But with the new guidelines, it's really gone away from that and focused more on symptoms. So at this point, the guidelines are that for at least 24 hours, a student or an adult needs to be symptom free. So they need to be getting better, feeling like they're getting over their illness, and they need to have not had any fever and not using fever reducing medication for at least 24 hours. Both of those things must be true before someone returns to school. And when they do return, so let's just say that they're gone, so and then they come back after this, then for the next 5 days, they should be taking more precautions. So steps to improve their airflow, hand hygiene, masks, physical distancing, and or testing when indoors around others. So those are the guidelines. Dr. Wallace has these and Lori has these, and I'm sure Grant County has these as well. And so he may have or she may have additional input on this as we roll into the updates from our LHJs, but these are our current recommendations for COVID-19. There is no, I know we really like to have these flow charts, but we have not received any flow chart about this from Department of Health. So this is the guidelines we're going with for the moment. Another place that you can find additional information about schools and really respiratory diseases is to look in the DOH Infectious Disease Control Guide for School Staff. This came out in June of 2024, and the COVID guidance for schools is on pages 32 through 34. Now, I would really encourage you to be in contact with your LHJ. Make sure that you're reporting if you're suspecting that you have an outbreak, you start having multiple kids ill, particularly in the same classroom, you have teachers ill in the same classroom, and that you're following your policy and your procedure on your reporting of infectious diseases to your own local LHJ, and then use them as your guide for your actions. So this particular manual is available at this link through the Department of Health, or you can access it on the school nurse Google Drive, and it's in a couple of places there. So the other group that we need to be kind of paying attention to is labor and industries. And that's of course because all of our districts have employees. So labor and industries pretty much follows, again, the same CDC guidelines. So for at least 24 hours, symptoms getting better, and again, without a fever and without taking fever reducing medications. Both of those things need to be in place for 24 hours. They again encourage, if the worker returns to workplace, they need to be distancing themselves and using ventilation, distancing, and testing. And if they return with known or suspected COVID at the workplace, then they need to wear a well-fitting respirator for 10 days following the onset of symptoms or a positive test. And there's a link there if you'd like to read all of the L&I guidance around COVID management. There's a link to the complete guidance. Okay, so moving into naloxone and opioid responses. So, you know, with a change in the laws and the RCWs last year, now we anticipate that many districts are going to have naloxone in all of their buildings. The law expanded beyond the limitation to high schools to really expand to every school building with the law to have a doses of naloxone, as well as to have trained staff available to provide it. So we're most of these things are just rolling out. So we're anticipating we're going to have some guidelines revisions. The last ones came out in 2022, and also the WASDA templates. Those are also anticipated to have revisions. They have not actually been launched yet, but what we can be looking for are going to be things like access in all school buildings, ready access. There's going to be better descriptors in the documents of where to keep the naloxone so that it is readily accessible when needed and it's not maintained in a locked setting. And then there will also be information in there on student self-carry, which has been a topic of conversation for about the last year as naloxone standing orders became available and students were able to simply purchase or obtain their own naloxone. Some of them were electing to carry it in their backpacks. And so there is language coming out in the new guidance about student self-carrying. Another thing that has come up is the Washington State Proviso, which is kind of the description of the language of the law. Now, some of this is actually not appearing in the RCW, but if we were to pull up the Washington State Proviso around naloxone, we can see that the language includes providing naloxone actually to students who need it. So in other words, if a student has let's say a student has parents who are using opioids and the student is afraid that the parent could overdose and needs to have some, then it's okay for a school district to provide it for that student. There are rules around that that we need to be looking at, and certainly it would be a decision that would be made by the administration of the district. So if something that you feel that your district wants to pursue, then you would want to have a discussion with your district administrator. You can get a copy of the proviso. We have it posted in our naloxone folder on Google, so you can open that up. It does require that the distribution be confidential, so the student shouldn't even need to request it. It should be just simply available to them somewhere. However, it does require training. So there's a poster underway, working on a poster to provide schools with a link directly to the training video so that a student could at least read the instructions in bold print and they could click on a QR code to access the Washington Department of Health video on naloxone administration. We're also hearing of some community organizations that are being given funding from Department of Health to help with this type of naloxone access. So a good example would be Room 1 in the Okanagan County has already approached Methow Valley School District about providing them with free naloxone purposefully to be able to just give it confidentially to students. So we're looking for more input from some of our community groups who's getting funding for this type of thing and can provide that type of support. So more to come on that. We are still waiting for updates. You should, if you need a standing order, be using the 2024 standing order, and there's a link to it right here. Another legislative change that's coming out now, and you're going to hear more about, is the fentanyl House Bill 1956. And this is really the one that addresses education and around fentanyl and opioid issues. And so as a result of this, OSPI has been tasked with creating both content, creating and disseminating instructional materials, as well as updating the objectives around and standards for health education related to opioids for middle and high school students. So you can read about that in the OSPI bulletin. It's called Fentanyl Opioid Use and Abuse Learning Outcomes Addendum in Washington K-12 Learning Standards. And then there's also an addendum that goes along with that, that goes into more detail about the standards and about some learning objectives. So this is going to be incorporated as a requirement into middle school and high school. It could be in their health class, it could be in another class, but the content does need to be there for them.
Kathy, we have a naloxone question in the chat from Tiffany. Do staff need to take the online training course to be trained for naloxone use?
Do staff need, I'm sorry, do staff need to be trained?
She asked if they need to take the online training course in order for them to be trained to use the naloxone.
Well, you would want to put together your training course for your staff. Could consist of a variety of training tools. So so one example of a training plan for school district staff could include something like, could include face-to-face training with you, where you went through the Department of Health curriculum on opioids and fentanyl. So that could be one way to do it. And then it would involve hands-on skills and verification of their skills. So you would be able to have them practice using naloxone trainers, and you would also be going through your policies and procedures of where is your naloxone kept? How do they access their naloxone? So they would need to know where to go to access it, how to report, what to do, should they need to administer it, who do they tell? So your own processes. So it's not kind of a one size fits all training program. So you're going to want to put together your little training plan for what are the components of your training for your district. And that's what the staff would need to complete in order to become a naloxone, designated naloxone administrator. Now, the district is going to identify, you should be working with your administrators to find out, well, who are the naloxone administrators going to be at your districts? Oftentimes, naloxone administrators might be all of your staff who are trained in CPR. That would make sense that all of your CPR trained providers are going to have the skills and knowledge to administer your district's naloxone. So that would probably be a place to start. And there may be other folks who are not CPR certified, but certainly can be trained to administer naloxone. The requirements for it are fairly slim in terms of, the number of people. It just suggests you have, 1 or 2 people trained at your buildings, but that's really not very many people. And I think that you want, if you're going to have naloxone in your buildings, you want to make sure that you have a sufficient number of staff readily available to respond, because if you only train 1 or 2 people and those people are out, then you have no one left. So you want to make sure that you have enough people trained to cover you. Does that answer the question? There is a vector solution course on, which is good. There's a vector solution course on that includes nasal naloxone administration. There is also a very good Department of Health video, which we encourage everyone to view. And it is on recognizing an opioid overdose and then naloxone administration. And excuse me?
Oh, I was just going to say what Sarah Kruger said. To clarify, in case I missed it, staff must be retrained every year in order to administer naloxone, just like with regular medication administration?
I would recommend that you do it every year. Most people don't remember things from year to year. And so it would just be good practice to make sure that every year you have reviewed this with staff. And that you have documented that training for your at least for the folks who are designated by your district as responsible for administering that medication.
And if you don't have trainers, we have a medication kit that you can borrow. We have some trainers, and we have access to trainers if you need some, right?
Yes, thank you. Thank you, Sheila. Yes, if you don't have enough trainers, you know, many people might have one, but one is often not going to be enough. So you may want to have more, because if you have a group of people, if you have multiple trainers, it lets more people get that hands-on experience for a longer period of time. Some fentanyl opioid resources for you. Well, the OSPI guidance, but again, that's under revision, so that's going to be changed. We have the Washington DOH naloxone in high schools document, and we are a participant, so we have the stock supply that was provided by DOH, but that DOH medication was specific to high schools, and we're trying to comply with the contract we have with DOH in terms of ensuring that we give that to high schools. We still have some doses of that. So if your high school needs a dose of naloxone, or you have a dose that's expiring, let us know and we'll replace it with our DOH supply. That document
Kathy?
also, yes?
Sorry, circling back really quick to training staff. When Sarah had another question, it's not the same as medication delegation, correct? In
Correct.
legal terms, right?
Correct.
All right.
That's correct. Yes, anyone, the state allows anyone to administer naloxone. So that could be a staff member, it could be a student, anyone who has naloxone and is able to administer that, and it would not require delegation from someone. Now, if you had injectable naloxone, that would probably be different, but we would not encourage a school district to maintain a stock of injectable naloxone that needed to be drawn up and administered that way. We'd prefer that all districts, and in some cases really schools should have the nasal format of naloxone. And then there's some other materials on here that you can go to find training resources, handouts, materials, just a lot of tools that are available to you or to your school. If schools are looking for curriculum, for example, Department of Health has recommended a couple. At the bottom of this list, there's EverFi, which has a course called Prescription Drug Safety, Know the Truth. So that would be an option. However, to access it, you have to create an account on their site. But it's free, and that is an option for schools as they're looking for middle and high school curriculum.
Yes. I don't think we should like stay at the recess and come over here. Okay, just a minute because I can't hear you. Say that again.
Okay, that wasn't a question for me.
No,
Okay.
I think she accidentally unmuted. I
Oh,
took care
okay.
of muting for her, so
Okay.
you're good.
And then the other course is the Stanford Medicine Halpern Safety First lesson. So that also is an option. Oops. Didn't mean to click it. All right, and just some current statistics I thought were kind of impressive. You know, we often talk about, well, what is the outcome of some of the work that's being done around naloxone and getting naloxone out to schools. And you can see that the big increase, these studies were done by Taranella and Mikos. And they started actually studying naloxone back in 2017. They were looking at, well, what was the impact of naloxone on adolescents? And they began looking at how it was prescribed for adolescents and the volumes that were going out. And they did another study again now in 2022, and they're looking at the difference between 2017 and 2022. And you can see how much it's gone up. So in how many, this is just for youth, so this isn't talking about how many were distributed for adults, but you can see a 669% increase in the number of prescriptions that went out for naloxone for youth. Pediatricians rose 1,000% over that 6-year period. So when we talked about, you know, training providers and different types of providers to make sure that these prescriptions are being filled. And this is before there was actually free naloxone in a standing prescription in Washington state. So this is across the US. And so you can see that these numbers have definitely gone up. And if you are going to be working with youth and you're looking for, you know, how to message, or, you know, what kind of message might be useful for your students, I would recommend you take a look at this article, How Should Harm Reduction Strategies Differ for Adolescents and Adults, which is really, I think, important to understand that, you know, some of the approaches that sometimes are taken for younger students may be much different than the approaches that are taken with adult population. So in other words, the work is working. The efforts around getting the word out are working, and we are seeing more and more naloxone available for young people. The next thing I wanted to address was the new Washington State Standing Order. So we've had problems over the years. Many districts have struggled in trying to get a standing order for epinephrine so that they could have undesignated epinephrine at their schools to use by the nurse in the event a student had an anaphylactic reaction and the student did not have any epinephrine available. In those cases, when the student doesn't have a dose and doesn't have an order, then the nurse could recognize what is happening and they could pull out a undesignated dose of epinephrine, and they legally have the right to administer it to that student. But that was a very problematic practice because not every district could find a provider who was willing or interested in providing a signed standing order to allow the district to go out and get some epinephrine that was not designated for any specific student. So as a result of that dilemma, a new RCW was passed, and you can see the link here, and it is called, it's actually a revision to the previous one about how epinephrine can be obtained in the school districts, and that it gave the authority for a statewide order for standing epinephrine. So we now have that available. So that, I hope, is going to be a big time saver for folks. That was the goal, was that we could not only have emergency medications readily available because we weren't struggling to find someone to write an order in order to obtain them. So this is your new order. Now, note that it's 5 pages long, and that is true. This whole thing is a package. Think of it as a package. It is a combination of forms as well as a prescription, and it all goes together. So this is just page 1 of this document that talks about Washington's law and authority to have the standing order, and you can access it on the Washington Department of Health website, or you can go into the Google Drive under Tools kits and you can access the document there, and you can read the RCW. Yes.
Question. So, like I order from the epi to school.
Perfect.
So when I put that in, I can just fax them this, or it's just already a thing. Like, how does that work? Usually
you're just exciting me so much. Hold on one slide and I'll show you how to do it.
Perfect.
Okay, perfect. Okay. So these are just some of your other pages. So you can see the pages, you know, have a lot more information on them than just a little bit. And you can see over here, this is one of your pages, and it's an order form. It gives you options. So it's going to give you options of what are you requesting for your standing. Are you requesting AviQ? Are you requesting an EpiPen? And notice way down here, we're going to talk about Neffy. It also includes the nasal form of epinephrine, and that's a 2-pack of Neffy 2 milligrams. So all of these things are options. The standing order is signed. The standing order is for 2024, and we'll then get these revised as necessary. But this is all part of your 5-page package. If you use EpiPen for schools, if that is your provider of your free epinephrine, they have had multiple conversations with the Department of Health about this process and about making sure that these EpiPens are not delivered to the Department of Health. They are delivered to your school district, because that was kind of a big concern when we tried to launch this project, was that these were going to get mailed to DOH and not to your school. But I think that's pretty much taken care of. When you want to order your pens, make sure you use all 5 pages. So you can't just send that one last page that looks like the prescription. You have to send the whole thing, including the prescription, and you want to send it into this link, your valid prescription link. When you go in, for those of you new to EpiPen for schools, first of all, if you want to use this, you have to create an account. Your school may already have one, but if they don't, you need to create an account in order to order free EpiPens from them. And so make sure you have an account. When you go into your account and you link into your portion where you're placing an order, click the valid prescription and upload your 5-page document to that, and don't upload it to the standing order. That's a different section. So don't put it in there, put it in valid prescription, and your free EpiPen should come to you. Now, certainly you could also, if you have funding to purchase them, you could also go to a pharmacy. You could take that same 5-page document you should be able to take it into Walmart or Walgreens or another pharmacy and use that to purchase EpiPens for your school district if you chose to go that route, or if EpiPen for schools runs out. So if they run out of product, then you would have to find it somewhere else. So quick update on Neffy. This is the brand new medication that's just been on the market for a very short time. In fact, I believe it's going to be launched in October, but you could see it was already posted on the form. So it's already available on the order form. So it's a nasal medication route. It's for kids who are, I'm going to skip through a couple of things here, but here's a link to information. If you want to order a trainer, you can order it on this website. Go in, enter your NPI number, order your medication, and watch for updates in the anaphylaxis guidelines from OSPI, as well as potentially in our templates for policies and procedures. Those just are not out yet. Quick training video. You can access this training video on YouTube and get to it that way. And there's some indications. This is for kids that weigh more than 30 kilograms or 66 pounds. And then there's a variety of safety information around the use of this product. And all of that is available to you right on the Neffy website. So I would encourage you to go there and look for information. We don't know how many students will have orders for this product yet, but certainly could be a route that your district might choose for their stock supply. We just got a update today in a new link to this document. This is the health and safety guide for K through 12 schools. This document really reflects a lot of environmental as well as a broad range of topics around health and safety for schools. It had been sorely in need of updates. We hadn't updated it since 2003, and now it is current for 2024. And here are your links to get to this manual. And I want to thank those school nurses who provided input into this, because that is appreciated. And so make sure that you take a look at that and see what that contains. And to do that, here's some easy ways to do it. You could go to a program. There's going to be 2 workshops coming up, one in September and one in November. And these are going to be the same workshop, and the agenda, I'm sorry, it's kind of blurry here, but it's essentially going to be covering a lot of the topics that are in that new health and safety manual. You can do either of these by Zoom. You can register with these links, and all of these are in the school nurse calendar. So you can just go to the calendar and look for the environmental health safety workshops and register electronically for one of these events. And I encourage everyone to go. You won't want to miss attending one of these.
Kathy, we have a quick question about storing epinephrine. Would it be okay to store an EpiPen in the staff room with the AED in its cupboard, so it wouldn't be locked away as well as in the office?
Well, I think that's a really good question. And I think I don't know. That because it is an injectable, you might want to keep in the health room. But I think that would be up to your district to decide where you want to keep an injectable form of medication. And if you want to, I believe people do keep it there already, or keep it, it's certainly kept in an unsecured spot. You know, one of the things I do encourage people is if you're keeping your medications like that in your AED cabinets, then someone needs to be checking those cabinets very regularly to make sure that those medications are in there and that they haven't been removed. So because not everyone has locks on their cabinets, some people use those nice breakaway locks so that they can just look at their cabinet and see their, you know, if it has a glass front, they can see their medications. Other people need to, they put a little breakaway lock on the door so they can tell if somebody's tampered with it. We just want to make sure that if somebody does have an emergency and they run to that location, that the medication is there for them. So it would require frequent checks. So very good question. So here's some additional health and safety resources. Again, these are all in the Google Drive for you. We just want to make sure that you're aware that the Department of Health is updating their materials. Couple of WABON updates. This is a pretty simple one for those of you who have questions to pose to the Washington State Board of Nursing. They've created a little Ask the Practice Team link. You can get to this little button and you can enter your questions to them on multiple pages from the main web page. So support for practicing, commonly asked questions, practice resources, contact practice consultants. You can go to any of those pages on WABON and you will find this little link. And so if you have questions, please use the button rather than just emailing them. They get a lot of questions from nurses, and by having this little standard form, it's going to help them collect the information they need. And some more WABON resources and references, and all of these links are available to you directly on the WABON webpage. Only one quick legislative update, and this is regarding Initiative 2081. Lots of concerns around the Parents' Bill of Rights that passed back in 2024. So we do have some initial guidance from OSPI, and they are continuing to collect feedback. And so there were concerns about this. People wanted to make sure that students' information was really being secured and not shared inappropriately, even with parents. And so you can take a look at the guidance on the OSPI bulletin. You can also provide your own feedback. So if you have feedback about this and concerns, you have concerns around student confidentiality and the impact of this initiative, then you can click this link and go to the OSPI website and enter your feedback there for them. And they would appreciate that. Okay, just a reminder about the SNO conference coming up October 11th and 12th in Wenatchee. Here's your registration link and a link to the agenda. And we hope everybody comes because this is our opportunity to present this conference in our region. And we are representing the whole of Central Washington, from the northern border to the southern border. All counties are represented as the areas that are supporting the SNO conference this year. So please come. This is just, again, a reminder about the environmental workshops and your registration links for that. We're restarting School Nurse Connects, and School Nurse Connects, for those of you who haven't attended in the past, is an opportunity for school nurses to get together with Washington Department of Health on a variety of topics. They usually hold 3 to 4 School Nurse Connects per school year, and our first one this year is going to be October 3rd. All of them are from 3 to 4 p.m. You have the registration link here, and it is also in the Google School Nurse calendar. And this first in the series is going to focus on head injury data. Our DISH program is our Diabetes in School Health program. Again, for those who have not attended before, this is a 10-minute presentation by an expert in diabetes care, followed by a 50-minute discussion on care and practice in Washington State schools. So if you are caring for school students with diabetes, or you just need to learn more about pediatric diabetes management, this is an excellent opportunity for you. It's free. Here are all the dates for 2024 and 2025, and you can register for all of these in the Google Calendar. They are also recorded, so you can get to back copies. Some additional updates and training. PDA training is pretty much coming to a close, at least those that are being provided by Confluence Health. And here's a variety of programs that we have coming up. So some of these are webinars, some of these are in-person sessions, some of them are roundtables related to mentoring and developing mentoring skills, but these are all open to any interested school nurse, and you can register for any of these things in PD Enroller. Okay, so I'm going to stop sharing because my time is up, first of all.
Kathy,
Yes.
for those PDA, the PDA training, is that the diabetic, or is it just in general?
Well, PDA, there's only 2 PDAs. Good question. There's only 2 PDA types. So you're either going to be a diabetes PDA or a seizure PDA. And Confluence Health provides diabetes PDA training.
Okay.
So those are specific to diabetes PDAs.
Do they have to be in person, or can it be via Zoom?
They do them in a they could be in person. They could be in person down at Confluence Health in Wenatchee, or you could elect to do them remotely. If you do it that way, then certainly you would need to schedule it with, talk to Sheila about getting something on the schedule if you haven't done your PDA training yet, so that she can coordinate a date with Confluence Health. You would want to be either attending it, or you're going to be responsible for their skills. So you're going to need to make sure that you have the equipment that you need for skill testing and your skills checklist, and they will complete their course when you send those documents to them. Then your PDAs will get their certificate.
Okay, thanks.
Welcome. Okay, and anyone who has any other questions, please put them in the chat, and we'll be happy to get back to you with a response. And then I'm going to turn it over to Lena, because I believe Dr. Wallace is next, and here he is.
He is. Thank you so much for all those updates, Kathy. Lots of great information for us to incorporate into our school year and into trainings for our staff. Dr. Wallace, thank you so much for joining us this morning. We're always glad to have you and really appreciate your time.
Yeah, thanks for having me. Thanks for having me back. Welcome to school, everybody. Welcome to the year. I hope things have settled a little bit from the initial rush, but I'm sure life is always crazy in schools. So hope it's not too bad. I know that there are a lot of new nurses, new folks on the call. So I want to introduce myself. I'm Jim Wallace. I'm the health officer for Okanogan County, the interim health officer for Chelan-Douglas County. So work closely with both those public health districts. I'm also a family doctor. I work, all over Okanogan County, mostly in TWISP, and then in the hospital in Omak at Mid-Valley. I was there all weekend, so I'm a little tired. Still haven't caught up on sleep. But I do want to share with you guys just kind of a recap of some of the public health activities that have made us busy, kept us busy over the over the summer, and things I anticipate might be some answers or prompt some questions from you guys that I'm happy to work with you on. Are you able to see my screen? Not sharing?
It's not showing for us.
Try it again. How's that?
Thank you. Yep, we can see it now.
Cool. Let's make that better for you. Yeah, so we closed the year with pertussis, and I wanted to give you guys an update, take a look at what's going on with that. Had a COVID increase in June that's unfortunately continuing. Have worked a lot on wildfire smokes, but I think are in a nice spot now and have missed worse wildfire smoke over the summer. Rabies has kept us on our toes. I think it's keeping a number of you guys on your toes. I'm happy to have folks share experiences if there's interest there. And then as we get into the fall, we're doing preparedness for respiratory illnesses. Also looking at vaccine preventable illnesses because a number of those are on a rise. And then still don't feel like we're out of smoke season yet, so we might see some late fires that threaten to impact school activities. So I want to talk a little bit about that. So when we left in May, our pertussis outbreak in Chelan Douglas Health District was on its way down. Fortunately, that was an outbreak that led the state at the time. 87 total cases, first detected by a school nurse. And so, because of close relationships with that school and the schools that were involved, I feel like our district was able to jump on top of pertussis much faster and really identify more cases than we otherwise would have, and were able to limit the spread of the disease through testing, treating active cases, providing medications for post-exposure prophylaxis. And since that time, the whole state has seen a lot more pertussis, and I anticipate that flowing into the coming school year. More in Western Washington than Eastern Washington. But if you look at the slide on the bottom, the number of cases that we saw up through May is much smaller than now what the state as a whole is experiencing. We'll see if those cases go down with a shift in illnesses and just the change in season, but certainly had a much higher number of pertussis cases across the state over the summer than normally would be expected. So kids with pertussis typically don't present with a really high fever, but have a really noticeable cough. And so it's important to identify those kids that are having this dry, hacking cough and exclude them from school. They have to be excluded for 21 days from the onset of their coughing symptoms, unless they get treatment. So treatment's usually a 5-day course of an antibiotic, and they should be excluded from school for 5 days while they continue that. But as soon as they finish the 5 days of antibiotics, then they can come back to school. Kids who have been exposed don't need to be excluded, and kids that are vaccinated or unvaccinated vaccination status bears no difference in whether they should be excluded or not. So only kids that are sick need to be excluded, and kids that have been exposed should take antibiotic prophylaxis, but don't need to be excluded unless they develop symptoms. COVID-19 in June started to rise from really a 3-year low point in the middle of May. But as in years past, we saw an increase in the summer months and are still seeing a relatively high rate. The emergency room visits for our region that you can see here on that first pink line appear to be increasing over the past 2 weeks. and are almost as high as they were last winter. We don't get cases reported to us in public health quite as frequently. Sometimes healthcare partners do report those, but they're usually the cases that are collected from emergency rooms and hospitalizations. So the clinic diagnoses, as well as folks that have home tests that are positive, don't get reported to us. So we're not able to report on actual cases as we used to be. We do watch wastewater data. And so you can see in the bottom, the left is Wenatchee, the right is Brewster. Really appreciate those municipalities putting collection sites in their wastewater facilities. But as you can see recently, there's been an increase in COVID-19 and wastewater in both sites. So we had a couple of big fires, Pioneer, Easy, Swawilla, and a ton of little fires. Fortunately, they got jumped on really in all of our counties, and really and I'm impressed with the resources that were devoted to stopping fires very quickly that were threatening homes and threatening our towns. Certainly wished we did not get hit as hard by the Pioneer Fire and others. They really made air quality difficult in late June throughout July and into August. We had great forecasting. So the airnow.gov and Washington Smoke blogs give a historic and a future prediction of what wildfire smoke will be like. So that was really helpful for us for planning and working with community partners. This graph is from Manson in I think the middle of June. And you can see that as days go by, each day, or three or four of those days had unhealthy for sensitive group levels of air quality, and usually peaked in the afternoons. And it's nice to watch that trend and to understand what's going on locally for our counties, for our communities, and I know for schools as well. We did a lot of work with fire and EMS to support their activities. Had a lot of our staff members attending the coordination meetings on each of the fires, had really good collaboration with the forecasters and other leadership from the fire incident management teams. It did a lot of distributing masks and air cleaners, and then supporting the library system and other organizations that set up clear air shelters. And worked with event hosts, worked with folks that were planning events and were worried about impacts of wildfire smoke. And so shared a lot of forecasting and a lot of kind of contingency planning ideas, and fortunately did not have to make any closures or advise folks to change or reschedule their events. So we've had three bats that have tested positive for rabies in Chelan and Douglas counties. And so that is, I think, appropriately raised a level of concern that probably should have always been there in the first place. It's not an increased number of bats that are testing positive for rabies. It's just, I think, a demonstration that rabies is out there and bats do carry it, and we shouldn't be messing around with bats. And so the bats that were collected were either dead or acting in an abnormal way. So it was kind of curious, why is this bat trying to swim around in the water, or why is this bat dead in a place that bats normally don't hang out? And so we've actually ended up collecting a lot of bats. We prefer to only do that, and public health labs will only accept a bat that's actually been in contact and potentially exposed someone. So we can't send all bats, and public health can't collect bats. So animal control is willing to do that. Fish and Wildlife, if it is a larger animal, are the folks to call. The LHA can certainly help you identify who should be called if bats need to be collected. But regardless if you can catch the bat or the animal, individuals that have been bitten or scratched by an animal, especially a wild animal, certainly a bat, but even domestic animals should wash the wound with soap and water and get healthcare attention. And then healthcare and public health can work on identifying whether that individual should receive the vaccine and immune globulin as post-exposure prophylaxis for rabies. So we've worked with a number of community members that do need to get that post-exposure prophylaxis. And fortunately, everyone who has been indicated has been able to receive it easily through our hospitals and clinic systems. So there's no shortage, and access has been really good. We've had great participation from healthcare. As we jump into the fall, I know the infectious disease control guide has been updated. I have reviewed it. I can tell you that I haven't gone word for word through the whole entire thing. It's hefty. You guys that are seasoned veteran school nurses probably know it better than I do, but I do enjoy exploring cases and looking deeply into it with you guys. Certainly when there are inconsistencies with other guidance that you see and need clarification, I certainly want to help and support you with that. I know questions are starting to arise about exclusion for school or what to do with various respiratory illnesses, especially with COVID, because the guidance has changed now, and kids that have COVID fall into the kind of same class as respiratory illnesses for other reasons. So that is that with the onset of respiratory symptoms, a student or a staff member should be excluded from school for 24 hours until the fever resolves for 24 hours. Symptoms are improving. And then as long as healthcare or other testing doesn't warrant a longer period of isolation, pending treatment like pertussis or several other diseases that require a longer time away from work or school. Outbreak reporting, I've not seen changes to COVID definition of or outbreak definition for COVID. That's 5 cases or 20% of a classroom, or however you might define a cohort, an individual, a group spending time together as in classes. Every school is different, every grade is different, so it's really challenging sometimes to identify what that cohort is. But certainly our staff members at our LHJs are experienced in working with you guys on that. I've got a meeting with health officers and DOH later this week, and so I'll ask about any changes in that outbreak definition. But because it's a definition that's aligned with state and national outbreak definitions, I doubt that's going to change. If any doubts or any questions about any of the infection control guidance arise, please contact me, contact public health or your local health jurisdiction, and certainly want to support that. So we're seeing both a rise in, I guess, at the same time, we're seeing a rise in vaccine preventable illnesses and a decline in either vaccination or a decline in people keeping up with their vaccines. I think a lot of that is due to lapses in healthcare access, probably more so lapses in healthcare access than people not wanting to get vaccinated, but both are going on. At a time when we're seeing measles outbreaks in the state and across the country, and are concerned that we're kind of a setup in North Central Washington for a big measles outbreak, and want to do everything we can to avoid that. Measles is challenging because it requires a 3-week isolation period for anyone that's exposed, not just anybody that has measles, but anybody that's exposed to measles and is not vaccinated must stay home for 3 weeks. And that's the incubation period, the time in which you anticipate that somebody could become contagious and test positive. from when they were first exposed. So we don't want to require that or don't want to force that upon families or students. That's a huge disruption in life. And that can, continue on, because in households, that isolation period begins with the last exposure. So if there's continuous exposure within a household, you just continue to push that 3 weeks out farther and farther as additional family members get sick. So it's a really frustrating situation. I think we saw it a lot in COVID, especially when isolation periods were 10 to 14 days. So we'd like to avoid that, like to avoid absenteeism. The state is improving school data as well as the Washington immunization information site because there's a difference in denominators. People can move in and out of the state and still be counted. So that skews the data a lot. But there is an attempt to clear up those discrepancies, because when you look at the healthcare immunization rates, they oftentimes differ than the school rates. But regardless, improvements there are occurring. And then clinic organizations are also doing a lot of work right now to improve their ability to get kids and adults in for immunizations. So locally, clinics are talking about expanding hours, making immunizations possible through urgent care, and then even just scheduling nurse visits rather than a full provider visit to especially get kids in, but try to get anyone in that needs updating in their vaccine status. I think fortunately we're seeing improvements in staffing shortages. That has been a huge issue over the past 2 to 3 years, and fortunately, I think folks are able to fill a lot of positions that have been open for a while. Our LHJs want to support schools that have questions or are working on improving not necessarily, vaccination status of everyone, but also that gap in vaccination. So the non-compliance rate is high, I'd say across our region and specifically in certain districts. And you can go and look at your district and other districts compared to the state or compared to others at the immunization status dashboard. And I think that's really helpful to look at if you recognize, hey, there's one district that is doing a really good job in their non-compliance rate. I'd love to hear what success stories people are having and what people find is really helpful in driving those rates down. And then we'll talk a lot more about wildfire smoke. It's really designed to be a recap of the wildfire smoke season next month. Liz Walker will be back with us. And through her help and work with ecology, work with the Forest Service and other players, we've really had a lot more preparedness in this smoke season, and fortunately haven't had as bad of a smoke season. The outlook right now is pretty favorable, cooler, wetter weather on the horizon. You guys use those resources at the Smoke blog and EPA Air Now. The wildfire school guidance hasn't changed since the spring. So take a look at that. Happy to answer questions on that. And I think schools are doing a good job from what I've seen, and happy to support others that have questions on updating outdoor activity policies. I'd love to see assessment and indoor ventilation needs, because I'd be one to advocate for whatever grant funding or other kind of funding we can put together to improve HVAC systems and other ways to improve ventilation. And then, it's always nice to have communications prepared ahead of time rather than scramble at the last minute to get something out when the weather turns or smoke turns. So when it's not quite as bad, if you guys are able to work on that, it certainly pays dividends when smoke gets worse. So that's it. I'll stop sharing. I know we got a late start. I should probably scoot in 5 minutes or so. I wonder if there are any questions or any opportunities for discussion.
I have a quick question for you, Dr. Wallace.
Yes.
The bats that you had talked about that have were found to have rabies.
Yep.
There wasn't any cases of
No,
rabies, just the
so
bats.
no human cases. We've only had 2 human cases in Washington in the past, actually since the 1950s, I believe. So we do a really good job at identifying people that have been exposed and getting them treated. The 2 cases I've reviewed, and I've gone back through the records of those individuals' experiences, they actually did not know they had been. I take that back. Well, they didn't know. They didn't realize that they had been exposed. There was one was a 65-year-old gentleman who lived alone and came in with seizures and neurologic changes. And it wasn't until after he passed away that they realized that he had rabies. And then the other was a 14-year-old girl who unfortunately passed away with a similar presentation after about a week of a febrile illness. They assumed that it was rabies and recognized that there was nothing they were able to do. And after she had passed away, in hindsight, the family recognized that there had been a bat in their house about a month prior. And so they didn't recognize that she had been exposed, and so she wasn't able to get that prophylaxis.
Okay. One other thing really quick, just wanted to make sure I clarify on the newest COVID guidance that we're basing the time away from school more on symptoms as opposed to a rigid 5 days out.
Correct.
So people are out for at least 24 hours until they're fever free and symptom free.
Yeah.
Well,
yeah.
resolving.
Right. Yeah. Not symptom free, but symptoms improving. Some people aren't spiking a high fever. If you've got updated immunity because of a recent infection or recent vaccination, typically the fever is not going to be as high and the symptoms aren't as bad. And so some people, fever is not the predominant symptom, and some people's fevers aren't really high enough to hit 38. Or 100.4. And so those individuals, just waiting 24 hours after their onset of symptoms and then returning after their symptoms are improving. For COVID or any other illness that does result in spiking a fever, then you ought to wait 24 hours after the fever resolves. And I'm watching the clock tight with my kids, and really want to document. All right, when did that fever stop, and can I get them back in school tomorrow? So it's crucial. It's important, and I'm sure families will have a lot of questions about it. And so if you need help answering questions, let me know. And Michelle, yes, we got a new COVID booster. I think there's some sites that already have it out. And reviewing the data from the COVID booster last year, the most impactful or I guess highest yield time was the first 4 months after the booster dose. And so, there's been a lot of talk about, do we wait a little bit longer before starting to get it? Influenza, I think, that is one that people are going to jump on top of right in September. I would not delay getting either. You can get both of them first, and learn from my mistake last year that you can't predict when you're going to get COVID. I tried to wait until COVID increased to get my COVID shot, and COVID got me first. So don't do that to yourselves. If you are planning on getting vaccinated, I would talk with your healthcare provider or check in with the pharmacy that you might be able to access and find out when they're going to get it, and go ahead and get it.
All right. Thank you so much, Dr. Wallace. If we have any other questions that come up in the chat, we can email them and then make sure that they're distributed to the nurses when we get your answers.
Sounds good. Yeah, I'd
for
be happy
those.
to
I
happy to
know
take
you have
calls
to go too.
anytime. Appreciate communication with you guys.
Yeah, we really appreciate your time and your help. and your
All
support
right.
for us. So thank you so much. It was great
Yeah,
to
you
see
guys
you.
take care. Bye-bye.
Have a great rest of your morning. All right. So now we are going to hear from Dr. Megan Carter, who is an audiologist with Better Hearing of Washington. She's going to be joining us to review assessment of ears for just general ear health, and then also review hearing screenings. So, Dr. Carter, I can see that you're on, but I don't see that you have your camera on yet. Okay. Hmm. Let me see if I can.
I just asked her to unmute
Okay.
and I can ask her to start video.
Okay.
And it looks like she might be talking.
Sorry, I didn't realize had my mute on this whole time. I apologize.
Oh, you were
Um,
talking. I didn't know I had my voice on the other day, a while ago. Sorry.
That's okay.
Mhm.
While we're waiting for Dr. Carter to be able to return to the meeting, I was wondering if everyone wouldn't mind adding something to the chat about um, how your school year is going. Um, you can use maybe let's do 5 words or less of how your uh, how your school year is going, or something that you've been able to accomplish that you're really excited about. All right, let's see. So great, busy, excited about the EpiPen order. Okay, that is awesome. I know, Jody, that the standing orders for an epinephrine is phenomenal. It's going to really open some doors for us to be able to have epinephrine in the schools. Looks like it's been a chaotic start, but stable now. That's so great. I'm glad to hear that things are calming down for you, Sarah. First fall without HRA. I'm sorry, Michelle, I don't know what HRA stands for. And I'm seeing some cumulative folks that have switched over. Uh, that it is always tough to learn a new student information system at the beginning of the school year when it's so busy. Um, excited about the nasal epinephrine. I know, Melanie, that so exciting, that new nasal epinephrine. Um, and I don't know if you've noticed, but the the delivery device with the Neffy and Narcan, um, and I believe there's one other, maybe is it the Valtoco that is also the same delivery device. So that is going to make training staff um, quite different, but a lot nicer, I think. Health room assistant. Okay, thank you, Michelle. And I saw that Dr. Carter was still working with a patient,
Mm.
and so she needs a few minutes. Okay. Oh, okay. I think we all need to give Ben a little bit of a clap because he's got 100% of his medications and emergency care plans in line already. That is a feat. That is huge. Way to go, Ben. Great job. Okay. Um, with this group, I did want to ask if there's anybody that is planning on or has enrolled in PD Enroller for the clock hours, because we are offering those clock hours, and this year it will be 18 clock hours, I believe. So a substantial, a good amount of clock hours for the school year if you're able to attend or watch the Zoom call or the Zoom updates. So if you are, would you mind just like using your reactions to raise your hand so I can get a good idea of who is planning on enrolling for those clock hours? 1, 2, 3. Okay. Oh, 4 others. Okay. Fabulous. All right. Thank you. I appreciate knowing that because it is quite a um, it's quite a task to make sure that we have everything in line for those. And I just wanted to make sure that it is something that you want to have and that you could utilize for your practice. Um, so we will make sure that that is continues to be available to you. All right.
May I add something to that?
Absolutely.
Oops.
Sure. Go ahead.
Can't tell if I'm muted or unmuted.
You're unmuted. You're good.
Okay, good. So in talking to some of my coworkers here, they thought the best way to mark attendance on that is to wait until the very end of all the sessions, then mark attendance, then the survey comes out. Then you have the opportunity to purchase all the clock hours at once. Then the cost is less. If you start out and start purchasing them right away, it's $15 per session versus what is it? 18 times 3, $54 for the whole thing. So don't fret when you don't see I haven't marked you attended because I'm not going to do that till the end.
The
Okay.
end being the end of the year or the
Yep,
end of
the
the
end of
session?
May.
Okay.
So
Okay,
I'll make
gotcha.
a note of that in the PD enroller.
Okay.
And then
That's good to know. I
I think what we
appreciate
can
that.
do, Lena, is we'll send out a few things along the way. Like we have our own survey that we've done that we can utilize that. And I'm just trying to kill some time here till Dr. Megan gets back on. But we have some other things that we could do that we can
Yeah,
check in with people, see how it's going.
that is a good idea. And that might not be a bad idea for you after some of our Zoom updates, even if you are watching them live, to fill out the surveys to keep us informed of topics that you might like to hear
Mhm.
about in the school year as well. So, and
And you're
Kathy
referring
has,
to the Zoom surveys that are in the Google folder.
correct,
Right.
correct. For those that generally watch the recording, they can fill out those Zoom, or sorry, the form. But I see that Dr. Carter has her camera back on. It's great to see you.
I'm so
Kathy, really,
sorry.
oh
It's
no, we're so glad to have you with us and we appreciate your time. So thank you. Really quick, Kathy, you did have your hand up. Did you have something that you wanted to add really quick
No,
before?
no, let's let Dr. Carter.
Fabulous. Thank you.
Yeah,
Okay.
thank
Dr. Carter, we're going to give you the floor. We're
Wonderful.
super excited to have you and hear a review of the ear assessment and then also touch on the hearing screenings.
Yes, I have my slides ready. Do I need to share my screen or does somebody else have them?
If you have them up on your screen, you are more than welcome to share your screen.
Perfect. I have them. Where did they go? Do share. There it is. Ta-da. Okay, so hello everyone. My name is Dr. Megan Carter. I am an audiologist and I am your educational audiologist contracted with the North Central Educational School District. So hello. I'm going to be talking about hearing screenings as well as just review and assessment of ears, just kind of a review for that. Also going to talk about how to handle referrals. So when you do a hearing screening, if you have somebody or a child that doesn't pass a hearing screening, how to handle that referral, some data management and reporting, and then closest hearing resources for each county, as well as some equipment and tips and tricks on how to use the equipment. So there we go. So the purpose of a hearing screening is to identify children who may have hearing loss and to determine if further evaluation of hearing is needed. This is straight from the WAC from Washington. So schools must conduct auditory and vision screenings for all students for kindergarten through 3rd grade, 5th and 7th grade. And then any child who enters your school, any child entering a special education program, any student showing symptoms of possible hearing loss or vision loss, and any student referred for a school auditory or vision screening by a parent, guardian, employee, or self-report. So why is this important? Hearing is different than listening. We all know this, right? Hearing is the acoustic access to the brain. It includes improving the signal to noise ratio by managing the environment and using hearing technology. But listening is focusing and attending to that acoustic events that are available. Hearing must be available before listening can be taught by parents and teachers and early interventionists. And hearing loss can interfere with the development of a child's spoken language, reading and writing skills, and academic performance. Hearing loss can often look like having limited or unclear speech, not following directions or paying attention, asking for repetition, saying, huh, what, I can't hear you, and can also cause or may look like learning difficulties. So auditory screening requirements, you must present tonal stimuli at 1,000, 2,000, and 4,000 hertz at 20 decibels as measured through earphones, so over-the-ear headphones. The auditory screening equipment requires calibration of those frequencies and intensities at least every 12 months, so once a year, using a designated audiometer calibration company. So I use a company called E3 Diagnostics. They're based in the Seattle area, and they probably come out, and Dennis is the guy who does mine, comes out and calibrates lots of equipment. The district should designate an audiologist, myself, or a staff member, which may be the school nurse, to provide audiology program oversight. So who has auditory expertise? Speech language pathologists do, teachers of the deaf do, regional audiologists, and the audiometer calibration company. All of those people are going to understand in some capacity what all of this stuff means. So where are you going to do a hearing screening? You're going to do hearing screenings in a quiet environment, in a place away from known noise sources. So don't do your hearing screening in the gym or next to the gym or next to the playground or where there's like announcements going off. If you have a speaker in the room, we want to make sure the room is quiet. And you're going to test 1,000, 2,000, and 4,000 hertz at 20 dB. You're going to present that 20 dB tone at each frequency 2 to 3 times and vary the time in between the presentation so not to establish a pattern. Kids and people in general are very keen to finding patterns to things. I had a gentleman just earlier today who was pressing the button incessantly, and even I wasn't even presenting a tone. So don't establish a pattern. Try to switch it up a little bit by varying the time in between how you're presenting the tone. And instructions are very simple. I'm going to play some soft beeps. I need you to listen hard and raise your hand when you hear them, even if they're very soft. Some kids will raise their hand and keep their hand up the whole time. So you got to practice. And you got to say, nope, put it down and then listen and then raise your hand and then put it down again. Why do we test these frequencies? Well, these frequencies are the easiest to hear in a room that is not sound treated. So when they come see an audiologist, they're going to be put in a sound treated booth that we can test all of these frequencies. But these frequencies are also really important for speech understanding. So this is what we call the speech banana. It has all of the different speech sounds that we make out of our mouths and where they fall dependent on frequency and loudness. So if we are testing here, we are making sure that they have access to all of those speech sounds, or at least the important ones, that we can check. And if they're missing some of these, then that means we need to refer so they can get more testing. So when you're looking in the ears, you probably will see earwax or cerumen. If it's a lot of cerumen, you may want to consider retesting or referring the child to the pediatrician to have earwax removed. You may see an ear infection or some gunk and debris in there, probably coming out from summer months. You might see some swimmer's ear and just some weird things in people's ears. If you can't see the eardrum, so the rule of thumb is if you can't see the eardrum, you want to retest, because if you can't see the eardrum, then it's possible sound can't get through there and you're not going to get a valid test result. Other things to look for on the pinna are some pits and tags, and I have pictures on the next slide to go over that. And then any malformation of the pinna or the external auditory canal. If there are pits and tags or malformation, that usually is a sign that during development, something didn't develop correctly inside the internal ear or the cochlea. And so that needs to be kind of assessed and red flagged. A lot of times those kids have already been picked up by their pediatrician and have already gone through the referral. So you may already have like a known thing of like, yep, mom knows he's got a pit on his ear, or this child has atresia, they don't have an ear. This is known, document it, make sure that you kind of know for future. If the child is wearing a hearing aid or cochlear implant or a BAHA, don't test them. Make sure that you have a copy of their most recent audiogram on file for their IEP. Make sure that they have an IEP, that they have something in place, but you don't need to test a child who already has a known hearing loss. You're just going to waste your time and you're not going to find any good information. So there we go. This is what you might see. So when this right here in the lower left corner is a normal ear canal. So we've got a beautiful ear canal. You can see the eardrum. You can see the malleus. Nice cone of light. Everything looks beautiful. This on the top left is earwax. You might just look in there and just see a glob of earwax and not see anything at all. And then this is a pit. The middle section here is a pit. And then we have a tag, a preauricular tag. And then microtia and atresia are just the absence of the outer ear or the pinna and or the ear canal. So you might see kiddos that have a malformed pinna, and they come in different grades. I wouldn't bother testing that ear. You want to test the other ear if the other ear is not affected. Some of these kids might already be wearing a BAHA or other sort of treatment intervention. And if that's the case, then again, make sure you have their most current audiogram on file. So if a child responds to all frequencies in both ears, they are a pass. If the child misses one or more frequencies in either ear, you're going to re-screen in 1 to 2 days if possible. Children who do not pass the rescreening are then referred, and the strength of a screening program is only as good as its follow-up procedures. So how do we follow up? Your responsibility as a school nurse is to rescreen those auditory or vision screening failures and refer those failures to a specialist. So failed screening should always be confirmed by further testing. And the gold standard would be to rescreen them within 3 months. So if they failed their screening, we need to get them rescreened and retested within 3 months. You're going to notify the parent of the need and the importance of a follow-up and flag the student to assist with tracking to make sure that that follow-up occurs. Where can you refer? You can refer to the child's pediatrician. It's always a really good place to start. Confluence Health has an audiology team and department in Omak, Wenatchee, and Moses Lake. I have an office in Omak and in Wenatchee. Haran and Feevold has an audiologist in Wenatchee and Moses Lake, and then Micron Audiology has an audiologist in Wenatchee. All of those places I listed have licensed, certified audiologists, and that's where I would recommend that you send children. I would not recommend sending children to Costco or Miracle Ear, nothing like that. They need to see an audiologist. So those places have my stamp of approval. Data management and reporting. So you're going to try to keep track of the total number that you've screened for each school year, the number and percentage of children who did not pass the initial screening, how many did not pass the rescreening, how many were referred for follow-up, how many missed the initial screening, who has diagnosed hearing problems, who passed the hearing screening but then were later found to have a hearing loss. And then you always want to keep that calibration certificate from the equipment on hand. Mine gets emailed to me and I just keep it in an electronic file. Sometimes they give you like an actual printout, just keep it with the equipment so that you know that it's been calibrated. You might have children who are difficult to test. One technique that we use in the audiology world is called conditioned play audiometry. I have big Duplo Lego blocks and a bucket, and I just give them a block. I tell them, you hear the beep, you put the block in the bucket, and you're good to go. Some kids just are not good at raising their hand when they hear it, and that tends to happen around the age of 5 is when they get really good at associating, I hear something, so I'm going to raise my hand. Children under 5 or children who have a developmental delay may need to be conditioned to respond to that. So you can do high fives if you want to, have another person there and say, hi, give me a high five whenever you hear the beep. You can do a block in a bucket, anything like that. You want to condition the response at a higher intensity level so that they understand and grasp the task. And then you can go back down to the soft level beeps. If all else fails and you can't get it, then just refer the child to an audiologist because we deal with this all the time. If you have an OAE screener, you can use that. I think that's more, I have more information about that. It does not require a response from the child, but it does require that child to be still and quiet during testing. Some kids are good at that, some kids are not good at that. And it also rules out no more than a mild hearing loss. So this is not really our gold standard. Our gold standard is doing the tonal frequencies with the screening audiometer. That is our gold standard. And then most importantly, do not test a child who has a shunt. If they have a shunt in their head, don't test them. There are some magnetic properties in the headphones that can trigger a shunt to malfunction. So X-nay on that. And if they have a shunt, then I would ask for audiometric information from their managing care team, because if they have a shunt, they probably have a lot of other things going on. So equipment, most equipment is going to look a little different, but they all have very similar things. They will probably have 2 knobs, one to control frequency, so 1,000, 2,000, and 4,000 hertz, and the other to control intensity or decibels, turning it up or turning it down. You're going to leave the intensity at 20 dB. You're not going to change that. The only thing you're going to change on the knob is the frequency, so changing it to 1,000, 2,000, and 4,000, and then changing ear, right and left ears. Sometimes they have a button that you press right and left. Sometimes they have just a switch that you switch right and left. Always make sure you do a listening check before you start. Make sure you can hear the tone at 20 dB in the room that you're testing in. Some of you might have some hearing loss and can't hear that tone. And if that's the case, I'm sorry. Turn it up a little bit or find someone that might have some younger, better ears and make sure that they can hear that 20 dB tone in the room that you're testing in, because we want to make sure that the room is quiet enough that you can hear 20 dB. If it's not, don't change the intensity. You're going to change your environment. You're going to do something to your environment to make it quiet enough that you can actually do that testing. Okay, last year, there was a proposal to amend the WAC to add OAEs to hearing screenings. And I checked up on this again, and there has been no movement to this. The State Board of Health reviewed a petition to add OAEs at a 2020-23 board meeting. They have put together a special counsel to review this, and they're currently still waiting for a formal proposal as to what this will actually look like. So I checked on it like a couple weeks ago, have not seen any movement on it, but if I do, I'll let you guys know. It could mean that OAEs would be required for screenings. It could not be, I don't know. The pros for OAEs is that there's no response from the child. They're very easy to interpret. It is pass or fail, and it does screen at a broader range of frequencies, but it does require that the child be still and quiet, and it does only rule out no more than a mild hearing loss. And sometimes you can have difficulty with the equipment. Earwax can plug up the probe and cause it to malfunction. It can be hard to get a seal and make sure that it's sealing properly. So it's not without its difficulties. The NCESD actually has an OAE unit. This is what it looks like. And so if you want to use it or borrow it, I'm sure you can borrow it and do an equipment checkout. It essentially will give you, if it's green check mark means pass. If you get an orange question mark, that means it's referred. If it's test invalid, that means it didn't work and you got to try it again. Lots of things you can store if you want to store the test. Technically, you're not going to store anything. You're just going to write on the referral sheet what you did and what the results were. Speaking of that, oh, that's on the next page. Tips and tricks. So when you are testing a child, you're going to make sure that they can't see you pressing the buttons because they're tricky, and they will see you pressing a button and they will want to please you. So they're going to want to say that they heard it. So make sure you have them sitting in front of you. And then that way, when you put the headphones on, their right is your right and your left is their left, and you make sure you put the headphones on the correct ears. And then you can press the buttons and then watch the child, and you can observe kind of their behavior a little bit too. Another easy thing is to start right where you left off with the last screening. So right ear, left ear, and then just start on the left ear at 4,000 hertz for the next kid and then move forward. You don't have to do it in a specific order. You just have to make sure you get those frequencies completed. So as efficient as ever as you want it to be. And then these are some screener forms that I found on kidshearing.org that have your screening. So it has everything that you need to do. 20 dB screening at 2, 4, and 1,000 hertz. Did they pass? Did they not pass? If they did not pass, then you do a rescreen. They have that you would do a third screen. I think, honestly, if you've done 2 and they failed and you don't see any reason why they should have failed, like an earwax or they had a cold or something, then after the second rescreen, refer. If you want to do a third one, you can. I think that's a little excessive and a little waste of your time. I say if they fail after the second rescreen, send them to us. You're probably going to need some help when you do this. So have other nurses help you, other staff in the building help you. It's very simple to do hearing screenings. And the best way to train is to do a hands-on workshop with the actual equipment that you'll be using. If you want, there is some online training at learntoscreen.org. There's also a really excellent website called Success for Kids with Hearing Loss. that has some hearing screening resources. And then there's some skills checklist also available at kidshearing.org, where if you're wanting to train someone, make sure this is kind of the whole thing of what I just talked about, basically, in dummy language. I think that's it. Yes, there we go. Does anyone have any questions? That was fast and furious. I hope I was a little bit entertaining.
You always are, Dr. Carter. We
Okay.
appreciate you. Thank you so much. And actually, we have some of those forms that you displayed linked in our Google Drive. I used those in our orientation information. So if anyone wants to look at those, you can find them in our orientation drive as well as the slides that you have. We'll be posting those so the nurses can peruse those and find that link there as well.
Perfect. And if you have any
Thank you.
questions, feel free to contact me. I am more than willing to jump on a Zoom and help you figure out what it is that you're looking at, or how to even do any of this, or if you need a refresher, you just let me know. That is what I'm here for, to be your help. And then we have a teacher of the deaf team that does more boots on the ground. So they're there to kind of help as well.
Wonderful. Thank you so much. We really appreciate your time.
Yeah.
Does anyone have any other questions or comments for Dr. Carter? No? All right. Well, we appreciate your time, and thank you so much to Dr. Carter, and again to Dr. Wallace and Kathy for giving us all of this information today. And thank you for sticking around. I know we're a little bit over time, so we want to let you get back to your tasks there. But I do want to make sure that we post the slide here really quick, so that you can see. Oh, hang on. I can't really tell what you're seeing, but we want to make sure that you know that the information for the, the information for this meeting, all of the slides will be posted in our Google Drive. The recording for this meeting will be put in our, I believe it's also put in the Google Drive, but it is posted on our YouTube channel. And then if you are watching this replay, there will be an opportunity for you to still get your attendance credit for PD Enroller if you'd like to pursue getting those clock hours. So the information is on this slide. And if you do have any questions about that process or need any help with it, please feel free to email me. My email and number is on that slide again. So again, we really appreciate your time, and hope you have a great rest of your day. Thank you so much, everyone.